We've been telling you about the Health Minister. He's holding a public briefing on the vaccination. Let's listen in.
The 8th of February, I, as the Minister of Health, briefed the Interministerial Committee on the vaccination. This vaccination, Interministerial Committee on Vaccination is chaired by Deputy President Mabuza. This briefing was about the efficacy of the AstraZeneca vaccine against the 501YV2 variant of the coronavirus, which is now prevalent in South Africa. Of course, and in turn, this briefing was also made to the National Coronavirus Command Council when the IMC tabled its report, and this one is chaired by the President. The South African government is committed to ensuring that we utilize the best options and approaches to protect our population from infections, including that of COVID-19. South Africa has a well-established set of protocols of ensuring safe use of all new health products, and we're pleased that our research system is working well, not only in ensuring quality control, but also by leading global research work on the study of the coronavirus. And that's why recently there's been a huge discoveries about the issue of the variant, which was actually emanating from South Africa. South African scientists and researchers commenced their studies on the efficacy of the various vaccines during the year 2020. They paid dedicated focus on the effect of the vaccines against 501YV2 variant in the latter part of the year and in the early part of January 2021. I recall that in some of the briefings we indicated that a lot of research work is being done and there were many questions which were not answered, and from that point of view we would be able to bring to the public's attention any new information that came about as a result of those additional estimates were done on the variant. And indeed, South African researchers are collaborating with researchers from throughout the world so that they remain at the top end of the technology of genomics and research work. The results of these studies became available only on Friday, the 5th of February, and publicly released on Sunday, the 7th of February 2021. This public would recall scientists coming on board to discuss this issue. And the past few days, that's really been the issue that's being discussed, not only in South Africa, but all over the world. It is as a result of this work in which the government has directly invested that it was established that the AstraZeneca vaccine does not prevent mild to moderate disease of the 501YV2 variant. This timely finding has ensured that all the measures are taken to utilize the most efficacious vaccine in our vaccination strategy. All the vaccines were developed on the basis of the original SARS-CoV-2 variant, which was the prevalent one during the whole world. So everyone used the same structure of that variant. For most of the year, this was the most dominant. The government's processes of procuring vaccine preceded the discovery of the 501YV2 variant and other variants that have since emanated from different parts of the world. Before the efficacy result, receipt of the vaccine batches to await the results of the efficacy studies by our scientists. If this was done, it would have relegated our country to the back of the line for vacancies due to the global shortage of supplies. But because we wanted to start early, we then took a reasonable of about 1.5 million vaccines. Now, there are concerns in the public domain about the expiry date of the received AstraZeneca vaccine batches, which was 30th of April 2021. The vaccines actually have not expired. I think it's important to just underline that, because when the issue of expiry is being raised, some people think it's already expired, and in fact it must have been administered to people when it's expired, and that's not the case. In addition, in keeping with the original vaccination plan, if the Department of Health were to have proceeded with the AstraZeneca vaccine rollout, these doses would have been used up by the expiry date. In other words, the expiry date would not have been a factor at all because we would have started the vaccination and we're targeting at finishing them anyway long before that date. And there's no promises are given up to the end of the expiry period. But in this case, we expected that they would have been finished anyway by that time. Furthermore, the April expiry date was not really discovered by accident, but was through the implementation of our quality assurance and control protocols. So sometimes when the matter is being raised in the media and it comes out as people don't say that it's our information that they've used, which we already knew about. It's not so much that they discovered something that we didn't know about, but when it comes out to the public, it creates an impression that somebody discovered something that the department was completely unaware of. And checking the expiry date is one of the basic administrative things that you do when you manage medical products. Given the outcomes of the efficacy studies, the Department of Health will continue its planned phase 1 vaccination, targeting the health workers using the Johnson & Johnson vaccine instead of the AstraZeneca vaccine. The Johnson & Johnson vaccine has been proven effective on YV2 variant, and the necessary approval processes for use in South Africa are underway. The rollout of the vaccination will proceed in the form of an implementation study with a partnership between the Medical Research Council and the National Department of Health vaccination sites across the country. This will now help us to provide valuable information about the pandemic in the post-vaccination community, and thus ensure early identification of breakthrough infections should they occur amongst the vaccinated health workers. What we have now to see is once we have vaccinated a community using a vaccine that's of known efficacy, which is quite satisfactory against the new variant, then we want to just observe after that vaccination how much of the breakthrough infections occur. And this is important for us, both for looking after our health workers, but also for preparing ourselves in terms of what would happen to the rest of the population. Now, this is a safety precaution. It's not to find out anything new that we don't know about the vaccine. In addition, the country has doses from Pfizer for phase 1 rollout, so they'll be brought forward earlier than originally planned. That's been through our negotiation. But also, our scientists are continuing to evaluate other candidates, and we are simultaneously engaging manufacturers. We're in advanced stages engaging the manufacturers of the Sputnik V candidate. We have correspondence and discussions in terms of what they are suggesting needs to be done. Engagements with Sinopharm also continue, with already an offer which has been made by China of some vaccines, which is being considered. And in this regard, a non-disclosure agreement has been signed, and the ratification processes in SAPRA is in progress. Similarly, our engagements with Moderna are ongoing, and we'll make further announcement as we always do when we are in position. On the other hand, our scientists will continue with further deliberations on the AstraZeneca vaccine use in South Africa, and depending on their advice, the vaccine will be swapped before the expiry date. By exchanging unused vaccines before the expiry date, the Department of Health will ensure that the acquired AstraZeneca vaccines do not become wasteful and full of expenditure. Meanwhile, we wish to remind our fellow citizens that the mainstay of preventing COVID-19 until the country reaches population immunity remains the continued adherence to health protocols of washing hands with soap or 70% of alcohol-based sanitizer, wearing of masks in the public, and to keep to the 1.5 meters social distance. Kafishane nje esifisa ukugcizelela okwanamhlanje ukuthi sibe nombiko esinikeza ikomiti elibhekene nokukhishwa kwama-vaccine eliphethwe umhlonishwa usekela mongameli uDidi Mabuza kanye nekomiti eliphethwe umongameli elikhuluma ngendaba ze-coronavirus, lapho sichaze khona ukuthi kule migomo eminingi besibuka uhlangothi olubizwa ngokuthi i-AstraZeneca lukhombise ukuthi alinawo kahle amandla okulwa naleli gciwane njengoba seliziguqulile selime ngendlela esibiza nge-501 V2. Kodwa kubalulekile ukuthi noma kunjalo siyazi ukuthi lo mgomo we-AstraZeneca uyasebenza kuwo wonke amazwe anganalo lolu hlelo lwe-virus esesinalo lapha eNingizimu Afrika. Abanye abantu bethukile uma bezwa kuthiwa le migomo ebisifikile bisisondele ukuthi iphelelwe ngamandla, iphelelwe isikhathi. Kodwa sifuna ukugcizelela ukuthi asikapheli isikhathi sayo, siyophela ngo-April. Kodwa ngohlelo ebesihlele ekuqaleni sasihlele ukuthi kuyothi uma ifika siyisebenzise yonke singakafiki isikhathi sokuphelelwa isikhathi. Kodwa njengamanje into eyenzekayo ukuthi-ke ochwepheshe bethu basabheka ukuthi singalisebenzisa kanjani lolu hlelo, and phezu kwalokho sifuna ukubheka futhi ukuthi uma ngabe kuwukuthi asikwazi ukuyisebenzisa siyokwazi ukuyishintshanisa sithi buye sithole esesigabeni esifanele uma sesazi ukuthi sokwenzani ngalolu hlelo lwe-AstraZeneca. Umhlaba wonke uyawusebenzisa lo mgomo, unamandla futhi kakhulu, kodwa-ke ube ne-post-chair ochwepheshe bathi ukubhekisisa ukuthi yini esingayenza ukuba silungise lapha eNingizimu Afrika. Sizoqhubeka nokugoma kusukela ngesonto elizayo, kodwa kuloko kugoma kwethu ovela kwa-Johnson & Johnson osutholakala ukuthi wona unawo amandla okubhekana naleli gciwane njengoba lidla Afrika. Siyaqhubeka kodwa nokubuka eminye imigomo ngenhlelo zakhona ukuze sikwazi ukubona ukuthi imiphi enye engasube usizo njengoba sikhuluma ngalo vele eChina novele eRussia, lapho sisaxoxisana ngoba basinikeza ulwazi olusha lesingenalo. Ngakho-ke konke lokho siyakuhlela, uma sekukhona okusha sizokwazi ukukhuluma ngakho. Kodwa into esesithe sizoyenza sithe kuzothi uma siqala kwesonto elizayo siqale ngendlela ezokwenza ukuthi sibe nocwaningo lokubheka ukuthi uma sesibanikezile abasebenzi bezempilo lo mgomo kuzogcina isifo se-coronavirus sisavela yini, kubona ukuthi bavikeleke kangakanani, kodwa futhi nakusasa sibone nomphakathi wonke ukuthi isimo sihamba kanjani. Akusho ukuthi ufunisela ngoba sesiyazi ukuthi lo Johnson & Johnson uyasebenza futhi uphephile kubantu, so akukho ukufunisela lapho. Kodwa kufanele sihlale sibheka ukuthi uma sesibanikezile sesibagomile abantu emva kwalokho yini khona kuyothi masiqhubeka sibe sazi ukuthi kusiphi isikhathi la sokwazi ukuthi isifo sesigudlukile aseyona inkinga kuthina. Okwanamhlanje-ke ukugcizelela nje ukuthi emphakathini noma sizikhuluma indaba zokuthi siyagoma, kodwa soqala ngenhlelo ezihlukene kuzoba yilabo abasebenzi bezempilo bese kuba yilabo abasebenza kakhulu emphakathini abasendaweni yaminya nalabo abanezifo nathi sebekhulile bonke abazodinga ukuthi bavikeleke masishane. Sithole nomgomo futhi ovela kwa-Pfizer esesiqale nawo ukuthi siwusebenzise, soqala ukusebenzisa uma ngabe ufika kulezi nsuku ngaphambi kwesikhathi esasikade sisishilo ngoba sibona ukuthi asixoxisane nabo siwusondeze sisheshise uqala ukugoma. Konke lokho-ke sithi noma kukhona kodwa singakhona leli gciwane lisekhona phakathi kwethu, into ebalulekile ukuthi sigeze izandla, sisebenzise ama-mask, isifonyo, sesiqiniseka sokuthi siyama ngokugqagqana kube khona ibanga phakathi kwabantu abamile ukuze ekugcineni singabi nenkinga yokuthi sithelelane ngegciwane. Siyabonga-ke besifisa ukuthi uma kukhona abasenemibuzo sikwazi ukuyicacisa. Siyabonga.
Siyabonga Khabazela. Yebo ikhona imibuzo and ngizoqala ngazo indaba so let me just begin. There's not questions, Minister, so I think let's maybe take 5 at a time, and it will probably only be 2 rounds of questions. So the first question, Minister, is from Power FM. And the questions are, what happens to the money used to buy the AstraZeneca vaccine? Do we get some portion of it back? And when all is said and done, will Dr. Mkhize, will you, Minister, take the vaccine in front of the public, like how they do overseas? And then the third question from Ungosnati is, based on the projections of time and the vaccine, is immunity likely to be achieved in 2020 or 2021? We then have a question from Angelo Coppola from CGTN, and his question, will the rollout plan start? From Amanda Watson at The Citizen, she says the study, and I'm assuming by that was only a AstraZeneca study looking at the 501 variant, was only done on a little more than 2,000 mainly healthy people in the 31-year-old age range. I'm just reading how she's put it. Is the study going to be expanded, and if so, when? Tamar Khan from Business Daily. Can you provide an update on your plan for care workers with the Johnson & Johnson shot? When do we plan to start administering the shot? And the second question is, what do these developments mean for our plans to receive the AstraZeneca shots from COVAX and the African Union initiative? Are we going to be seeking alternatives in those platforms? And if so, what would be the cost implications? I then have a question from Snesi Postiba from The Record. She asks, with the research showing the efficacy of the vaccines diminished with the second variant, with the AstraZeneca having a drastic diminishing rate, is the department thinking of developing a vaccine in the country that can be used to deal with the forever developing virus? Okay, let me hold it there, Minister, for now.
Thank you very much. It may well be that I might not have heard the questions properly, but let me just try and deal with the questions as they have been raised, and I'll try and make it brief. What happens to the money used to buy AstraZeneca? We don't intend to go and claim the money back. We intend to use the vaccine based on the advice of our experts. We have been in charge now with WHO. I'm going to be even discussing with the Director General of WHO in the next 2 or 3 hours, and we're discussing with COVAX and everyone. Yesterday I was discussing with the Minister, the Secretary for Health in the UK, and everyone is trying to look at what is it that can be done, because in the rest of the world, this is a very highly well-used vaccine. So already some countries who are asking that we must sell it to them. All we can say to our public is that we will not waste the money. We will either swap the vaccine and get a different vaccine, or get batch if we're going to be using it. But if there's studies that's going to need it, we'll also use it there. So at the moment, we all just want to say that we wait for the experts to give us advice, and there will not be any money wasted on that, I can assure you. Will you take the vaccine? I'd really love to. I'd actually be ready to be in the first few if that is necessary. And at the moment, that matter is being discussed as to how do we deal with the leaders taking the vaccine. I've actually been approached by many leaders who have said that they've seen that there's some people who are anxious and not sure whether these vaccines are safe. They will only see when the leaders take the vaccine, and they've offered that they will want to be there to actually help for people to see that the vaccines are safe. So there are many of us in the leadership, whether it's churches, the traditional leaders, whether it's in government, in political parties, who are ready to take the vaccine, just to be able to make everyone understand that these vaccines are safe, and will be the first ones to eat that when that situation arises. Then the new projection, excuse me, the new projections, we're going to be revising them. We're just waiting for the complete schedule of the distribution of the vaccine, so that we can see when those vaccines are available. Because once you remove AstraZeneca, it basically removes one vaccine that was really going to be largely and massively distributed. So it means we have to re-look at that. So we will announce once we've got all the concrete specific details of the delivery of the vaccines, and then we'll look at it and revise the numbers. We are aware that the whole world is going through the same challenge of not being certain how their vaccines will be supplied. So we're discussing very closely. I believe that we will be able to start sometime, and I'm not in a position to give the date, because that has to be released from cabinet, and so that matter is being refined. Then the study of the 501YV2, it did involve about 2,000 people, 31-year-old and so on. We are expecting that our advisory team, the Ministerial Advisory Committee was meeting even last night, and in the next few, maybe a week or so or two, they will be able to give us how vaccines in the next study. But we are aware that there are many more bodies, such as WHO, who also are keen to actually work with us on this, because it did shock everyone that this AstraZeneca, because it's been highly rated, that it didn't have the desired effect in South Africa. So we need to just check what else can be done about it. So we'll know and announce in the next week or two. Then we have indicated to Tamarkan that we intend that we should start sometime next week, but the exact date I'm not the one to announce it yet, because that's not been determined. The AstraZeneca doses that have been secured from COVAX and AU, we will actually discuss with them and look at the value, and therefore look at what alternatives there are. And I'm sure by the time the delivery would have happened, it would be very clear what do we do with AstraZeneca. At that point, we'll be able to announce. But there's flexibility. Where from COVAX, we've conducted them, and the AVAT group, which is the task team on African vaccine availability access kind of testing, they have actually said that they'll consider our request to swap various types. And then here, this is basically on the basis that in this continent, there are a few countries that have already got this variant, particularly those around South Africa in the southern part, but not all the countries really would be worried about AstraZeneca on this variant, because it doesn't exist there. So we will then be discussing it in that kind of context. And the cost implications will be calculated at that point, but we'll really be swapping value for value. And so the last question was about developing the vaccine in South Africa. I think that's a very, very important point, because we as South Africans have got the capacity to create our own vaccines that has been used. And so the President has actually directed that the team must start looking into that matter. And we don't have much details other than to say, in principle, it's a good idea to build that capacity. Thank you very much.
Thank you very much, Minister. I actually only have maybe about one or two more questions from the media, and then I'll move to the Q&A and just see if there's anything that's covered. The Minister has actually covered a lot of the frequently asked questions. I'll just take one from Azara Karim from News 24. She's asking specifically, will the studies to test efficacy of the variants identified in SA be expanded in SA, or will the data that's going to be gathered from studies being conducted in other countries? And she's asking how long might this take to be concluded? And then she's also asked if the Minister can update us on plans to create manufacturing and production capacity for the JJ vaccine in South Africa, and will the data now to ensure faster rollout of this vaccine. I'm just going to check in the other group quickly, Minister. There was only one question there, which I think you had covered. Maybe Minister can just answer that question for now.
Okay. There is a request on some of the people who have said that they would like us to cover in other vernacular languages. I accept that that is very, very important. So we will be getting different officials and leaders to cover the various language group radios and explain this issue in much more simple vernacular terms. So my limitation, of course, is I couldn't cover more than one. So I think that issue is a very valid point. The second issue, this study, I think you said Karen who raised it, the study, will it be data collection and analysis, or a study that started afresh? We will await the experts to give us the guide. However, from what I can see, we're going to need both. We're going to need a study where we actually administer the AstraZeneca to volunteers, and at the same time, we'll also need to evaluate the data from all over the world. In fact, I think whoever will be doing the study will need to make sure that there's collaboration with a few other institutions globally, so that we are sure that the information we got has actually got the caliber that can withstand any sort of scrutiny. It's interesting, in fact, that even the first briefing on the AstraZeneca study by Professor Shabir Madhi, in there was also the principal investigator, who is Professor Pollard, who is in charge of the Oxford study throughout the whole world. And he actually was able to make a very clear distinction to say this study has done, the vaccine has been demonstrated to show in the UK. He even went to tell us about the variant in the UK, which he called the Kent variant. He also went to Brazil, what happened to the variant in Brazil. And he explained the entire thing and also indicated that they had the opportunity and the severity of disease to be able to get a very broad spectrum of conditions under which to evaluate the impact of the AstraZeneca. But then they were all surprised to see that when they came to South Africa, there was this kind of a different response that they noticed. And on that basis, we have a full sense of what happens in the rest of the world. And so the next study must still ensure that we do it exactly that way, that we are able to compare with what's happening in the rest of the world. Then we'll have a much more comprehensive picture. But I think it will be a combination of a study where this is administered to individuals, and then we gauge the responses. And in addition, we also look at other information data available to the rest of from the rest of the world. How long this will take is obviously going to be difficult, because this will be part of the detailed protocol that those researchers would have to work on. The plan on the J&J in South Africa, I've been informed that it's going very, very well on Aspen. There's a difference, for example, between Aspen manufacturing for Johnson & Johnson and what Serum is doing for AstraZeneca. In India, they were given the license to the Serum Institute, which basically meant that they would take orders and supply. They go through the entire manufacturing very in India. In South Africa, we have Aspen that's been given, is a contracted manufacturer, but in this case, they also deal with a certain portion of the value chain, which basically is about filling and finishing. That process is going very, very well. I've been in several discussions with the head of Aspen, Dr. Stephen Saad, and the other leaders there. They are very determined to fast-track this production in South Africa. So we do anticipate that they will have their first batch, probably, and I'm not their spokesperson, but just for purposes of the public to say the impression I have is that they will have their first batch manufactured around March. Now there's a period of about a month that they've got to hold any stock that's fully manufactured to wait until the end of the month. This probably means that it must start be available in April. But we have looked at the numbers of what they can manufacture. I will not announce the numbers. I will just say that I have been quite impressed with the speed with which they've actually accelerated their technology transfer, preparation of equipment, and readiness to engage. They did so particularly because they said they want to serve our country. They want to make sure that there's enough to serve the continent and the country and so on. But of course, the decisions on that are being taken by Johnson & Johnson at an international level. Even last night, we had a discussion with Johnson & Johnson. Their commitment to make sure that South Africa gets, properly serviced with these vaccines, and that the continent also must be, well served with these vaccines, and that where there's need branches across the world should also come and support the continent. It's actually quite unbelievable. We sit with them raising these issues. Their commitment is there. So I want to say that we have a base from which to start working on building a new capacity for vaccine in South Africa, and Aspen is already one of the assets that we need to be looking at. There's a whole lot of others. I'm not here discussing that detail because there is a process that will be discussed properly from government once there's proper information. But I must say that this is time now for Africa to actually build this capacity to do more, to manufacture their vaccines. And actually, we believe we need to be manufacturing more medicine, more pharmaceutical products, PPEs and everything. And when we did the PPE procurement earlier last year, we found that the bulk of what we needed was manufactured outside South Africa and outside the continent. It's actually not fair that a continent of over 1 billion people can only rely on what is being supplied from the rest of the world, and we don't have our own internal capacity. Fortunately, President Ramaphosa is the president of the African Union. In the last discussion that he was briefing the African Union and handing over as chairperson, everybody commended the work that he has done. But also they raised the point that this is time that we must take advantage of this crisis to build the capacity for the African continent. So there's quite a lot of enthusiasm to move in this direction. And I'm very pleased that this issue is being raised actually in public, because that's the way we need to go. Thank you.
Thank you, Minister. Okay, we'll take the last round of questions with Minister's indulgence. So there's a frequently asked question by the media if the Minister is confident that the provinces to roll out as when we are ready with the J&J. And then I picked up some interesting questions in the Q&A, Minister, so I'll just take a couple of those, and this will be the last round of questions. So the one interesting question is that some are saying that the AstraZeneca vaccine not being effective is as a result of the prayer by CJ Mogoeng. What will the minister say to believers who might not want to be vaccinated? And somebody has asked a good question, probably for themselves or somebody that they care about. Will someone with a heart transplant who is taking immunosuppressants fall under phase 2 of the World Health Plan? And there's a question here that says, will the vaccine be rolled out to communities? Is it going to be done via clinics, community centers? And what about people with medical aids? There's one who's asking, why doesn't the government not just sell the AstraZeneca vaccine to other countries that need it and can use it? A question, are we paying for the Johnson & Johnson vaccines, the first ones that are coming, or is it provided for free by J&J as part of the implementation study? Okay, that one was covered. Another, I think, good question that I'm sure many will want to have clarity on. Will the current COVID-19 vaccination plan underway, with the current COVID-19 plan vaccination underway, will this affect the annual influenza vaccine, which normally commences around March? And then I see there's a question that was posed a couple of times, but if Minister will indulge this audience, they want to know why we didn't take the sera of those who were infected with the variant and test that sera. So I think maybe just a little bit of clarification on the actual study that was undertaken to actually find out that we have an issue with the variant. I think if I just look at the other questions, Minister, I think they're more or less pretty much covered. So I think we can hold it there, Minister.
Thank you very much. It looks like you gave us an hour. We need more than that. So the question about provinces being ready, we have plans from the provinces. So we went through with them. They showed us what they were ready to do. We asked for sites. They provided the site. We asked for staff. They provided for staff. We asked for storage centers. They provided for that. But when we met with the portfolio committee, then they said to us, look, it looks like the provinces are very anxious. So I have to accept now that there is a degree of anxiety amongst the provinces, and we need to just interact with them more closely so that we are able to ensure that this process does not falter. I do expect teething problems because we are going to be superimposing the Medical Research Council research team on top of the Department of Health vaccination sites. So 2 days ago, I was talking with the team leader, Dr. Leslie Bamford, and I was quite convinced that they are ready, they are able to deal with these issues. But always the test is when the tire hits the ground. you then know when you start that where the hitch is. It's like when you're building a house, the only time you know whether the roof is leaking is when it rains. And so in this case, we are going to have to focus on that. We will do everything to support the provinces so that ultimately they are able to reach out to the numbers that we need to achieve on this particular vaccine. The second issue, whether AstraZeneca is not effective because of a prayer from Chief Justice Mkhize. Well, firstly, I did listen to Justice Mkhize talking about a vaccine from the devil. I must say that I think in a particular language you can say so, but as far as I am concerned, none of these vaccines are coming from the devil. Secondly, I didn't also hear him call AstraZeneca as such, but I also believe that we serve one God, and all of us as people, whether we're in London or in South Africa or anywhere, there wouldn't be a difference in the way that God would look at us, and therefore I wouldn't expect that God would actually want to act on a vaccine in South Africa when the same vaccine is doing well in London, in India, in Europe, and everywhere else. So I think we shouldn't mix the two issues as such. I think it was an expression from Chief Justice, really more a religious expression to assure people that if there's anything that might be wrong, they would be protected. Protection will come from God. But here, the AstraZeneca has not been shown to be dangerous. It's not dangerous. The issue is it effective against a new variant? And the question is that we need more information on that. We can't even condemn it. Excuse me. We can't even condemn it that it can't work. We're saying up to now it hasn't shown us what we need. And if you've read some of the experts, Professor Abdul Karim was saying we need a study of more than 100,000 people. And so there's a lot of that debate that's going on. I think AstraZeneca issue, so far as was reported by Professor Mahdi, is a science issue. It's not a religious issue. So let's really separate these two issues. We've got lots of religious leaders who are going to be coming out and taking the vaccine because, they have no qualms about it. At the end of the day, we would believe that that's the answer we have to solve the problem, to save the country. So I don't think we must create a confusion about it. Excuse me. Then heart transplant and immunosuppressed individuals. In general terms, we will be vaccinating people who have got comorbidities. But I want to suggest that someone who's got this kind of situation need to get the doctor to give them the advice. We are hoping that will bring the vaccines a bit earlier than originally scheduled, precisely so that we can protect people early. So we hope that it will happen much quicker than was originally planned. So in other words, we won't wait for a whole 3 months before we can start phase 2. We want to start a bit earlier than that. So generally on people who are immunosuppressed, you can actually give the vaccine because the virus is not a live virus that can take advantage of a weak immunity. And so in our kind of advice, it can be given by the level of comorbidity that's associated. It does need that must be a medical opinion associated with the vaccine, and at that level, we'll accept that judgment. Those who are under medical aid, we did explain some time back that we did explain that the medical aids are actually participating in the process. How we're going to do it is that you will go and get yourself treated, vaccinated, but we'll have asked you if you are under a medical aid. If the answer is yes, we'll charge you medical aid because medical aids have now been allowed to pay for the vaccine. We'll charge them for the vaccine, and then you will get the vaccine. You don't have to pay any money. there's also a cost of administration, which to pay for syringe, for the swabs and so on. All of that will be combined for those who are in medical aid. But having said so, if you don't have medical aid, you will still be vaccinated, but government will carry the cost of that vaccination. We're doing that because we want it to be easy for everyone to get vaccination. It's about saving the nation. It's a good, it's a public good situation here where we're saying to people, everyone who is in that category then must be given access to vaccine, must get it. Irrespective of whether they can pay for it, they've got medical aid or not, they must get it. And then the cost associated with it must go to the government or to the medical aid or to the one that's sponsored by private sector. All of that is back office work that you shouldn't bother yourself about. At the end of it as well, we are also saying we want to reduce the need for this whole issue to be to create another parallel industry or business where people will actually be selling vaccines at the street corners, and I'll give you a quick one. This is better than the government vaccine, and all those kinds of shenanigans which we have seen in China. They already started selling fake vaccines. We will not buy fake vaccines. We'll buy the real stuff from authenticated sources, and we'll test it. We'll be sure that everything, we can produce a certificate of analysis that can tell you what is in it, so that at any one time we know that this thing is safe. It's very, very important that we must understand that this is all about government making sure that we are safe. It's all about making sure that we don't get attacked by a virus that the whole world is already beginning to prevent, because we'll find ourselves being the only ones who can't even travel to other countries because they want to know if we won't spread the infection in their area. I'm quite excited with this one, because if the Johnson & Johnson is as strong as it's showing, and we start deploying it, and Pfizer has also started showing that, and any other that is showing that, it means our focus is to stop the spread of the virus early, so that if we don't spread it to any other communities. But also it means that we will not be stopped from visiting any part of the world, and no one will shun South Africa because they fear the virus, because they think they've got a problematic variant. So this vaccination program is going to be very, very important for us to make sure that we stay safe. And this is what the government is actually trying to do. Why not sell the AstraZeneca to other countries? Well, it's an option. I did say that, in fact, I was surprised this morning. I woke up with a couple of emails from some of the countries who are saying, hey, sell it to us. We will consider it. We will consider mainly that first our scientists must tell us what we do with it. Can we use it within the time that's available, so before it expires? And if not, can we swap it with anyone else? And we can swap it because we've discussed with COVAX, we've discussed with AVAT in the AEU platform. So we will see what's happening. But some of my colleagues as well, some of the ministers, will be approaching them to see if there's anyone who can be assisted and so on. As to what we ultimately do, we just want to assure you that there will be no wasteful expenditure at that point. We have a very complex agreement that's going to be finalized with Johnson & Johnson. And so we have a price tag for the orders that we're putting through to them. They will then be explaining all the details in terms of how much of that, because the amounts that will be coming through in the next week will not be a lot of vaccines, but in comparison to the whole total that would have ordered. So we will be then negotiating. It's possible that the first batch would actually be not paid for, because it would be covered more as the research stock. See, if we're able to achieve that, then it's fine. But if we have to pay for it, we've got no problem, because it's the same vaccine and it's the same content, it's the same amount. And so there is no problem for us. So we're prepared to do anything to deal with it. So we will get the final proposal in the next day or two, and then we'll be able to explain, how much of it can be obtained without payment, without free of charge, and how much we're paying for the rest of the other vaccines. Was what we are also looking for is urgent availability. So we'll do anything that will make sure that we get it. Then what about the influenza vaccine, which will be taken up during the winter time. I don't think that there's any problem with it, except one thing. There is a provision that if you're taking any other vaccine, you need to wait for something like 2 weeks or say about 14 days or so before you administer another vaccine. And this is a precaution, really, not that you won't take it. So in other words, if we're vaccinating people with J&J or Pfizer or whatever, then they need to always report when they want to do another vaccine. But they also need to report if they would have done another vaccine, which means they wait for about 2 weeks for that one to settle in the blood and start its activity. Then you get another vaccine. So that's what precaution I should just raise. And I'm very happy somebody has raised it, because it's one of the issues in the guidelines that we would have omitted because sometimes you don't think about this. But it shouldn't be affecting anybody. It must just be having a gap between the two so that we don't get one after the other. Particularly in our case, we do want to know how you're feeling after you have had the vaccine. In fact, we will actually be giving everyone an ability to report. Once you've done the vaccine, you must go and report if you feel there's something you're not happy about. So if you go out and look at the way that that's being done throughout the world, someone did a vaccine, they got a vaccine, and then they had a headache, they go and report the headache. Then someone was coughing, they go and report. The analysis afterwards must help us to see whether there is anything that people that have been induced, any symptoms that have been induced by the vaccine on the individual. So even if somebody had passed away and then we say, what happened? They said it was a car accident. It needs to be reported. It must be ruled out when they announce to indicate to indicate that we have we've checked on all of that. The issue is safety. We would not take a chance and give people anything we're not sure about. We would never do that. After all, if you understand government, the government is elected to serve the population, is elected by the population, and therefore their first interest is to actually ensure the welfare of our population. Our scientific communities, very advanced South African scientists here, their role is to actually find new solutions to keep our country and our people safe. That process, it means that whatever we do, it's safety for our people first. Yeah, we hear people sometimes they get suspicious, they're not sure, and so on. Look, we understand why. This COVID-19 situation has really affected a lot. All of us have lost friends, relatives, and it actually came at a very huge, rapid speed to affect our people. And so all of us were really rattled by the way it came. As a result, then everybody becomes suspicious. Some people have even said to me, I don't want to go to hospital because I'm going to die. And we say, no, that's why we're going to be saved. The problem is that people will always remember the ones who might not have made it, even though there are hundreds and thousands who did make it, as we always indicate. Right now, the recovery rate is 92%. All of that at the end of the day is to make sure that we keep our people safe. There will always be people who are suspicious. There will be always people who will reject anything that is being said. That doesn't really matter, because that with time, the facts will speak for themselves, and therefore people will always understand what's happening. And in a new situation, people aren't too sure, because there's social media, there are tweets, there are countries, and there are people in different countries are also reacting. They're also shocked. They're trying to find out what is the truth. And so others are, anxious about things that they've never seen before. All of that is normal. And I think we must understand that we must just persevere, work through this until we can save as many people to deal with, to save as many people as possible, and then make sure that, everyone is in fact safe. So why don't we test the sera of the affected people by the variant? That's what they do in the laboratory. And a lot of the work that was done also by the study by Professor Madi did involve those kinds of studies. And even before then, Professor Tullio de Loveria, Professor Abdul Karim, and so on, they reported to me how they'd actually been doing that work already. So a lot of it is actually happening. In fact, when we picked up this variant, we actually assigned our team to call all the manufacturers of vaccines and ask them to get the sera of those who have already been vaccinated so that we can see how those antibodies generated are dealing with the virus. And in the process, we also said they must export the cultured viral particles so that they are able to see how on their side this turns out. So a lot of detailed scientific analysis is being done to deal with this issue. Thank you very much. Let me hold it at that.